After suffering a wound, whether it was repaired by sutures, staples, skin glue, or left open, there are several things you can do at home to improve the chances that the wound heals properly. One of the key things that we know is that a moist healing environment is helpful to allow the skin to regrow and prevent cell dehydration and death. Now, this is important to know that the skin should not be kept extremely wet. It's not like putting your hand in a bowl of water for a long period of time. It just needs a slight degree of moisture for a few days to optimize the healing. This can be accomplished by putting a small amount of triple antibiotic ointment over the wound and then covering with a clean, dry bandage. It's important to know that a few people will actually have an allergic reaction to the antibiotic ointment, and that is something to be watched for, although it's fairly rare. Changing the dressing several times a day can be beneficial. If any medications were prescribed, in particular antibiotics, these should be taken as directed. Antibiotics are not typically needed for wound care. Only wounds that were grossly contaminated or had lots of debris that required extensive debridement or cleaning of the wound might benefit from antibiotics, but a vast majority do not require any antibiotics to be taken by mouth. As the scar heals, exposure to sun can make it appear more prominent. So after the first 72 hours of healing, using sunblock for the next 3 to 6 months can prevent that discoloration that makes the scar appear more prominent. Now, depending on the location of the laceration, whether it was on the face or the scalp or the hand, the amount of time that you leave the sutures in place or the staples in place varies. Typically, it's somewhere between 3 days and 14 days. Here's a guideline for the duration that you leave the sutures or staples in place before removing. On the face, it's typically 3 to 5 days. The scalp is a little bit longer, about a week. The chest and extremities are 8 to 10 days, and any high tension areas such as joints or hands or something that has a lot of movement is typically 10 to 14 days. When should you return to the emergency center? The key thing is any signs of wound infection. This can be fever, redness, red streaks, increasing pain, or signs of an abscess or pus formation. Now, despite washing the wound out appropriately and doing everything correct, you could put antibiotic ointment on and do all the things you're supposed to. Still, about 1 out of 20 people will develop a wound infection. There is some degree of redness that normally occurs with wound healing. This slight amount of inflammation is normal. In this picture, you can see some slight pink in the area that the sutures were placed, as well as along the laceration edge. This is a normal redness for a wound. This slide, however, shows abnormal redness. You can see these streaks of red that are coming from the wound up towards the elbow. This is an infection that's moving through the lymphatic system, and this is a definite sign of infection. Here you can see a more darker, deeper red. This is the development of cellulitis or a skin infection. On this slide, again, you can see the deeper, more angry red involving the leg. This cellulitis does require oral antibiotics and occasionally IV antibiotics for treatment. Some wounds can develop an abscess, and this shows a very tender area that can be firm or hard. It can have what appears to be a pustule on the top. Sometimes it will drain spontaneously and pus will come out. If you have anything that's very tender that's bulging up that you can see pus underneath, or it starts draining pus, that is something that requires attention. The pus must be evacuated for the wound to heal correctly, and that may involve an incision and drainage to get all of the pus out. Additionally, you should return if the sutures or staples fail to hold the skin together and the wound reopens. A small amount of bloody ooze can be normal early on in the healing, but any progressive bleeding or any bleeding that soaks through the bandages can be a sign that there is a complication with a vessel that may not be well controlled. Also, if there's any signs of nerve damage, such as tingling, weakness, or numbness near the wound or distal, meaning further past the wound, that was not at the time of injury, those can be signs that a nerve was potentially compromised or damaged. There's a ER physician that runs a blog called lacerationrepair.com. There's some fantastic resources. If you go to that website and go to the patient resources and then the laceration aftercare instructions, you can find additional well thought out, well prepared materials for wound care. Again, if you have any concerns about your wound, you can stop by at any time, and we are always open to quickly take a look and give you some reassurance or intervene if there's anything progressing. We'd like to thank you for trusting us with your care, and please let us know how you're doing, and we'd like to make sure that everything goes according to all of our plans. Thank you.